Okay, Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajmain. Yang berbahagia Tuan Haji Mursyid bin Kasim, the Dean of the Center for Foundation Studies, the National Islamic University Malaysia, Madam Shahrizad Saidul Haj, the Director of the Center for Foundation Studies, Deputy Deans, Deputy Directors, invited speakers, head of departments, principals, fellows, staff, and also student of CFS IAUM. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to all of you. I am Zainul Abidin bin Ibrahim. I am honored to be your MC for today's session. So before we begin, let us get the blessing from Allah Subhanahu wa Ta'ala by reciting the Ummul Kitab Al-Fatihah. On behalf of the organizer, Office of the Director, Center for Foundation Studies IIUM, COVID-19 Task Force, and also COVID-19 Operation Room, I welcome you to the sharing session on COVID-19 mitigation process at the Center for Foundation Studies. During this session, there will be two main segments that will be delivered by our expert. First, we will have our expert, Dr. Siti Masitah binti Jamaluddin, our Chief Medical Officer for IIUM Sejahtera Clinic at IIUM Gombak Campus. And also, we have with us Assistant Professor Dr. Adri bin Muhammad Aidid, the head of IIUM Kuantan COVID-19 Operation Room. This session aims to equip and prepare us with inputs and information on the mitigation plan of COVID-19, especially in our campus. As being announced by the authorities, we are now moving to an endemic phase, or what we call fasa peralihan. Furthermore, we will be having around 2,000 plus students in our campus after this Hari Raya holiday, and they will start their face-to-face classes in the campus, especially for art students. Thus, we need to be prepared. We as CFS IIUM committee need to be prepared and ready for that by having a comprehensive SOPs and guideline, because all of CFS IIUM committee is part of this. Okay, hold on. It is now already been around 3 years with this COVID-19. We are now moving to an endemic phase. We are not there yet. Okay, we are now in transition phase, so everyone need to be informed. Okay, so we need to be prepared, and by having 2,000 plus students in our campus, so we need to have a clear guideline, a comprehensive guideline for us, for CFS IIUM community. Okay, now it is my pleasure to invite our Dean, Tuan Haji Mursyid bin Kasim, to give his welcoming remarks. The floor is yours, Tuan Haji.
Ya, Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah, and thank you, Brother Zainul, for chairing the session. And I would like to welcome to all participants of our sharing session this morning on mitigation measures or plan for CFS in welcoming our students, inshallah, who will be returning very soon, okay, after Raya, inshallah, second week after Raya. And we are expecting, as mentioned just now, around 2,000 students, which is basically about half of our total population to occupy, okay, and to be physically available on campus. So I would like to thank the Secretariat, the committee for organizing, okay, this timely session. And I would like to also thank all the head of departments, okay, surely the director, deputy deans are around, okay, in which the selected participants, I believe, are mainly our frontliners, and surely this is not their first experience, okay, in dealing with COVID cases. At least we have been dealing and facing this pandemic, I think more than 2 years. But of course, with the recent changes made, okay, on the status of the pandemic into endemic, okay, beginning from 1st April, and the change of SOPs, surely we need to be updated. And this is basically an effort to prepare, okay, especially the frontliners, those who are dealing directly, accommodating the students with their stay on campus, and at the same time observing all the SOPs as imposed, to share experience with our what we call nearby campus, especially Kuantan campus and surely, okay, our main campus Gombak. Since these two campuses, and in fact Pagoh as well, they started to receive. In fact, they are now having almost full capacity, okay, of the campus. So with all the students around, how they manage. So if there is any positive case, so how to deal with that, okay, the quarantine and whatnot, and of course with the latest SOPs. So we need to be updated on this so that we prepare, and this is part of our sort of preventive action, or at least to minimize, okay, those positive cases, so that with the hope that our plan to have face-to-face classes, okay, especially for art-based program, could be materialized, okay, when the times come. And based on the latest what we call circular issued by MQA that I received a copy of it, all the higher learning institution are given basically until end of the year, okay, until December 2022, to slowly what we call transform, especially the modes of teaching and learning, from the exception given for the 2 years of pandemic, and of course continue with the endemic, to be online, to be on the hybrid, okay, modes, now to slowly back to normal into a physical interaction, especially with regard to classes as well as session in the laboratories as well as in the studio. Okay, so I would like to really thank all participants despite your busy schedules. Okay, classes already starts, but with the sacrifice, hopefully we make ourselves ready mentally as well as physically, and we need to anticipate, okay, worst cases, even though we pray for the best, as always reminded by Typhoon Nisham. We pray for the best, but we prepare for the worst. So in worst case scenario, how do we react? How do we respond? And how to minimize, okay, these cases, because yeah, we don't know, okay, who's next. Now it seems that it's quite what we call uncommon. Is we ask someone, have you ever experienced being COVID positive? He said no. Then he's something which is of exceptional case. Even I myself also graduated from this COVID, what we call, and now become an alumni for the COVID. So whatever it is, we hope that the discussion will be smooth. And I would like to really at the same time thank our speakers, Dr. Mashitah, okay, Jamaluddin, who spent his time to be with us, to assist and to share the experience and probably to guide us at the same time. Similarly to also Dr. Adri, who is at the same time in charge of Bilik Gerakan, the nearest to us in Kuantan, in which we can always what we call coordinate, liaise between these two campus, and of course get advice directly. And I believe that people from Kuantan, the expertise from Kampung, they are more than willing to assist and to, in fact, physically come to our campus. Should there be any need for that in the actual case, when especially when things are beyond control. But hopefully this is just a preparation, and we pray, as I mentioned just now, for the best, that if possible, not to have any single case of positive case in our campus, but at least to minimize if there is any, and we pray that whatever it is, that things are under control, things are manageable, and this is where we need to prepare with the knowledge, with all the skills, learn to know, learn to be, inshallah. And once again, thanks to all, the secretariat, the speakers, the participants, and with that, enjoy the talk. Aqul qawli hadha, astaghfirullah li wa lakum. Assalamualaikum warahmatullahi wabarakatuh.
Okay, thank you very much, Tuan Yi, for your remarks. I would also like to remind all participants to record their attendance for the session. Okay, the link will be shared later by the secretariat. Okay, now moving to our next segment for today. Okay, without further ado, I would like to invite our experts, Dr. Siti Masita binti Jamaluddin, our Chief Medical Officer at IIUM Sejahtera Clinic, IIUM Gombak Campus, to give her insight on the mitigation for COVID-19 during this endemic transition phase. Now, I would like to welcome Dr. Siti Masita. The floor is yours.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam, Doctor.
I hope that everyone is healthy and happy to join the sharing session today.
Yes, definitely.
I hope that I can contribute a lot to CFS, and I have prepared my presentation today. Let me find the button. Where is the button? Share screen. Okay. Let's begin, but you can interrupt me in between or at the end of the session. I think that you guys might be asking a lot of questions. Hopefully, I can answer all the questions. Okay, let's start. The CFS mitigation measures sharing session. Okay. So for all you know that in IIM we have one big council that manage the COVID-19 issues for all campuses. We call it IIM Sejahtera Council. It is functioned as IIUM Crisis Management Center. In all other institutions, they have the Crisis Management Center, very specific, and certain universities, they have an up-to-date center, but we have formed it into a specific council since the COVID-19, because we realized that there's a deep need for the council and to discuss all the problems of all campuses, because it's quite huge. We have many branches. There is the function is to identify, discuss, and solve problems related to COVID-19 pandemic affecting the institution. So what does that mean with the mitigate? Mitigate is made something bad, which is less severe, serious, or painful. Because at the very beginning, we all know that COVID-19 is something very new. Even the health ministry is also wondering what it is all about, and the SOP keep on changing from the very beginning, in the middle, even up till now, is always being updated. So we need this kind of council in our university to discuss and update and mitigate things from time to time. Okay, sorry, I think I should be making a better, what do you call the chart, but then this is how it looks like. we have the director as our advisor for the Sejahtera Council, and then we have the UMC members and the committee members of the Sejahtera Council will include OCAP, the ISC, the OSAM, the RSD, STAT, OSIG, OSHB, Finance, ITD, MSD, Development Division, AMAT, CPS, CFS, and KCA. You see, there's a SFS. And usually from time to time, our dean is being called, even our director, even sometimes Encik Taifu also attended our Sejahtera Council meeting, right? Okay, CFS mitigation plan. We should plan a strategy that tailored to the CFS community specification. So during the periods of minimal transmission, community should prepare for increased transmission. This is very true. We have to look forward since that the students are coming next month. Now we don't have like too much of cases, even for reporting to KPT for this one whole week, from Thursday last week until Thursday this week. I would like to congratulate the Gambang campus because no positive cases at all. So, but bear in mind, once we have celebrated the Eid al-Fitr, when everybody go back to their hometown and return, and the students return to our campus, there would be an increased transmission of the cases. Okay. This is actually the international standard, the measurement that we have to look into. First is we have to have a specific regulation which is simplified. We have to change the mind of people because now we are going towards a transmission to endemic, and we have to make the objective that we can rely on personal responsibilities and self-management. Okay, kita nak kena tambahkan kesedaran lah at the level of personal, the individual. We will encourage community responsibility to follow recommended action. So we go from the individual goes up to the community. That will be a lot easier daripada community kita suruh individual buat this and that. Kita nak jadi macam apa, nak suruh je. We have to change their mind. It's their responsibility and their responsibility to the community. But at the same time, we have to look into the legal authorities policy. We have to make a policy for mass majority. To be specific, now we are talking at CFS, so that suit to the CFS community. And then secondly, we need to have effective communication. It has to have a clear chain of command, and we have to make like easy access to information and resources required to follow recommended action. From our experience in Gombak, usually the Sejahtera Council will produce a guideline in the form of words and sentences, and later on it will come up with posters. So I think the same thing that can be adopted by CFS when you have like a certain guidelines that is very specific for CFS, then make it into poster, because the generation nowadays, and even for the public, members of the public, it's easier to see the posters rather than reading sentence by sentence. And the communication has to be clear to avoid panic among the community. And we have to identify the higher risk groups and reduce the severity of the illness. The focus will be to protect those at increased risk of severe illness. Yani, kalau we find out that there are certain staff or certain students with classified as in the high risk group, and then those who are disproportionately impacted and first responders. Ini kita kena jaga first responders kita, sebab kalau the first responders is actually impacted or being infected, they're ill, then who's going to respond to help the CFS to cater and manage the what you call if last time like it happened with cluster development. And then the main reason is to reduce interaction of the infected and non-infected people. And fourthly, we have to prepare to use all the tools that we have, focusing on settings that provide critical infrastructure or services to minimize the risk of disruption. Then the main I can think is about the residential, the internet, the food chain, and bear in mind that the healthcare should be able to take care of the sick people. Means that in CFS, the two stakeholders that we can look into is the ISC and SASMAC. And also about the vaccination, we understood that until 31st of March, those with Sinovac and Sinopharm, they need to get the booster. So we have to assist them to get the booster dose to complete the vaccination for these two kinds of vaccination, and minimizing disruption to daily life to the extent possible. So now we are moving forward towards endemic. So the frontliners are the public, the members of the public, and the last liner is the healthcare workers. If anything happened to the healthcare workers, then it's going to be very difficult for us to handle the rest. So the frontliners now are the public. Okay, get the people's trust to get the better and stable operation processes and outcome. People don't trust you, then it's very, very difficult for us to do the work. Let it be the frontliners, let it be the last liners. Everyone will be having difficult time if we don't have the trust to each other who is running the process. And then the existing public awareness programs to address immediate community mitigation needs. Then we have to adapt the intervention, and then we have to have a public support. And I forgot to add one. Another one is the what do you call the authority, be it in IIUM, be it the external from the IIUM. Okay, so now we are thinking whether we should have CFS Sub-Sejahtera Council, because we just want one body with a leadership, and we have like a clear we can have a clear chain of commands, and that's where we develop the trust, and that's where we can develop the mitigation strategy for the CFS. Okay, on the development of the mitigation strategy, there are 4 factors that we have to consider. First is about the epidemiology. We have to see the level of transmission and disease dynamic in CFS. We have to see the number and the setting, the classes, the mahalah, the office, and the source, whether the source of infection, like gathering activities, events, or outbreaks. And then the impacts of outbreak on delivery of healthcare by IC or SASMEC. So we have to see the infrastructure or services that will be affected. And then we will see the epidemiology of COVID-19 surrounding communities, be it in Gambang, and then we go to a bigger areas, the Kuantan, Pahang, and then the Peninsular Malaysia neighboring states, because CFS is actually in the middle between Klang Valley and the East Coast states like Terengganu and Kelantan. And we all know that in Kelantan, the vaccination rate is quite low as compared to other states in Peninsular Malaysia. And in the community characteristic, we can see the size of community and population density, where the density in CFS is going to be high next month when the students return, and level of community engagement and public support for the public health initiative, and size and characteristic of disproportionately affected population, and access to healthcare, whether the community having easy access to the healthcare, access to potable water and sanitation, which is clean water, transportation for the students walking and transfer to mahalah, to hospital, and then the plan large, we have to really plan if we are about to do large event or mass gatherings, because now it is allowed, and then MKN allow for full capacity, so we have to plan carefully. And then the CFS community connection to other communities, for example, in terms of transportation, if they have like market near the, what do you call, the Jaya Gading, and then how they connected with the community outside the CFS, and if they are doing programs externally. And then we'll see for healthcare capacity. So healthcare workforce in ISC, we have 11 staff. But we only have 2 medical officers and 1 dental officer. So these 2 medical officers is the one that actually helping the CFS to manage the COVID-19. So it's quite a small numbers. But for all your information that I was informed by our senior in universities, is actually the rate for 1 medical officer is equivalent to 2,000 students. So if we have like the explanation where we have 2, because if my understanding is correct, it is actually it's less than 6,000, so that's why we remain with 2. But hopefully that we can plan something to add on another medical officer for ISC in Gambang. And then number of surrounding healthcare facilities, we have klinik kesihatan. I think nearby we have one, a bit far, at least we can have at least 2 klinik kesihatan and SASMEC and also FSC. Volume of testing capacity to provide intensive care. So this is more on the HTAA and SASMEC, but hopefully this is not really applicable to us because most of our students are young people, and usually if they have COVID-19, so far so good, is there's no case that leads to ICU admission. And the availability of personal protective equipment. So this one we have to discuss further, usually from level of operation room and wherever which type of PPE that should be worn at certain processes. And lastly, the public health capacity, the public health workforce, the testing capacity, in which for us we have like 3 types. Now we have a widely available self-saliva test, and in the clinic we have the RTK antigen professional, and we can do the PCR in SASMEC from complicated cases. And the availability of resources to implement mitigation strategies, ability to monitor and evaluate implementation and impact of strategies, and available support from internal and other government authorities or organization. So what we can think of that usually these are the bodies that we are dealing with. The main campus in Gombak and other campus in Kuantan. For Gombak, we are also communicating with the KL and also Pago, and we have the PDRM to help us. The MKN as the provider of the SOP and guidelines, and the KKM, of course, our colleague to help us with certain procedures that is mandatory that we have to follow. Okay. Okay, then we go to the highlights of our IEM Gombak experience. So I don't want to discuss under common procedures like outpatient clinic, but for all you know that in Gombak we have divided our team into 2 groups. One is the outpatient clinic, and the other one specifically managing the COVID-19. We call it COVID-19 operation room. This is meant for temporary because we have a lot of cases, but at the same time we are also monitoring the COVID-19 cases for from all campuses because we have to do some reporting. And then for outpatient clinic, since that we have divided our team into 2, then we are not able to run the clinic into 2 shifts. Last time we ran the clinic until 10 o'clock at night, but now since that we have divided our team with 2 groups, then we only managed to operate our office hour from 8 to 5 because on the COVID-19 op room, they also have to, besides managing and monitoring the COVID-19 positive cases of all campus, they also have to manage our mini PKRC because last year the KKM have made the regulation that the category 1 and 2A and 2A is being managed at the level of they call home quarantine, but since that we don't have home in our institution, it's going to be hostel, then that's where the PKRC being built up. For medical treatment after working hours, then the students have to contact the principal and fellow after 5 p.m. And then the transportation arrangement is being made between the principal fellow in charge with the driver. But the driver, once they receive the call from the principal and fellow, usually the driver will call up and consult the doctor on call. But as of now, it's also a temporary measures. We have put doctors on call if we have active cases. As long as we have our mini PKRC, there will be doctors will be on call. And then plan of management, the driver will contact the doctor and decide, the doctor will decide further plan whether to send the students outside or to send the student at our PKRC, or we have to allow the principal to have their own plan. Accompany to the hospital. Okay, this is also an issue to our campus in which sometimes it's either the principal or the fellow have to accompany the students, but sometimes the students' preference, they prefer to have their colleague to accompany, but it has to be under the knowledge of the principal or fellow in charge. And then the transportation to return, the principal and fellow in charge must arrange transportation for the students to return to Mahala, and treatment is completed at the nearest government or private hospital. Okay. In this issue, for the setting of CFS, I have received a few reimbursement claim in which the fellows send the students to the nearby private clinic. Last time, before there is a ISC clinic in Gambang, it is allowed, but now it's not allowed. So the reimbursement is not allowed. It's not being approved. So bear in mind, if there is cases involving the local students, they need to be sent to the nearest government clinic or government hospital, either in Susmek or in HTAA or the clinic kesihatan nearby. So the reimbursement request, HWC will not approve any reimbursement request in the case if the students in Malah went to the government hospital without informing the principal fellow in charge. Since that after 5 hours, everything, they have to inform. So one of the issues that we have found out in Gomba is that, especially for the new student, they don't know who are their fellow, they don't know who their principal. So this is the thing that have to bear in mind, that make sure that the students knows who are their principal and who are their fellow and how to contact them. Okay, this is about our COVID op room and how we receive our patient. We receive the positive cases called via WhatsApp or IC outpatient clinic. And then we will advise the students to contact Mahala Safety Liaison Officer. Here we use the Safety Liaison Officer, but I'm not sure in CFS if the operation is based on SLO or just still remain with the name of fellow, because my understanding is that every KCDIOM, they should have their Safety Liaison Officer. So the student or the staff will report their case, the positivity to COVID-19 to the SLO. So the SLO will advise them for two things. One is to update MySejahtera, because this is where you will get the EHSO, electronic home surveillance order, and they will disseminate chronology Google form. And then at the same time, we'll transfer student to the quarantine Mahala. The transfer of the students, they will discuss later, because in Gomba, usually the transfer of the positive student is by clinic. But last semester, no, the early stage of this current semester, when the case is a lot, it cannot be handled by IIC because we only have a few drivers, and it has to be every day, even the weekend, even the public holiday. At the end of the day, we were asking the VMU drivers to help us, but not all the VMU drivers. Only we selected 4 of them, which they have to report to ISC every day when they are on duty, because they have to sign certain form to indicate that they are coming for duty for the COVID-19 operation. And then at the end of the month, we have included them into the COVID-19 allowance for the healthcare workers, because they are doing the high risk job, because it's a repeated exposure to the COVID-19 positive cases. And then we, after the COVID, the SO give the chronology Google form. We received the chronology Google form, and then we have our duty is in Gomba is actually we have to fill up. Even Dr. Naila in ISC Gambang, she also have to report the positive case to Gomba using this Google form, and they for us to do the reporting to the KPT, and also the master list IIM COVID-19 positive charge. So this is, we have been doing this from the first case of COVID-19, I think way back in 2020. And then the update, we have to update daily statistic, and this is how the process repeated every day if there is for positive cases. Okay, this is how it looks like, the dashboard. This is the one that the pelaporan KPT that we have to report. You see, actually there are 20 IPTA, So they want the numbers for positive, berapa yang pulih, berapa yang meninggal, and the case positive active. We have to calculate everything for all campuses. Here we are, the IIM. And this is also part of the, this is also the pelaporan that our doctors have to fill up, because at the end of the day, every Thursday that we have to accumulate the data for the reporting to the KPT. So they have specified the category for staff and students. They have specified the category, the punca jangkitan, status terkini. And then we have another one, the master list. So bear in mind, bear with us if we have asking a lot of questions from for the principal and fellow, because these are the information very important for us to do the reporting, and not only for the KPT. Sometimes when the cases become more complicated, we have to report the PKD, and then the PKD will be asking a lot of questions. So maafkan kami, but thank you so much, because all this while everyone from all campuses has been very cooperative. Okay, this is how it looks like for master list IIM COVID positive patients. We have from the case number one. Case number one was from students from Kuantan. So we have done the reporting from the case one. And we have, you see that these are the doctors in charge. From Kuantan also we have, we got help, got the information from the Bilik Gerakan Kuantan. Okay, there's also issues on the transportation. So I try to find, actually we found out in Annex 11, this is for protocol for ambulance transfer for patients under investigation PUI, and even the positive case, which I would like to highlight how many patients should be transported in ambulance. Whenever there are more than 3 patients to be transferred in single response, then the use of alternative transport than an ambulance should be considered, such as vans or coasters or bus or even trucks. So meaning that not necessarily that we have ambulance, but we have other options. Maybe we can design another vehicles that is specific designed to be used for COVID, or what we call suspected case of COVID-19. And then this is how it looks like COVID-19 allowance for healthcare workers. This is the borang from the HR. Not everyone will get it because they have identified only 6 categories that can receive, but it has to be monitored by the healthcare, the ketua jabatan in healthcare. Means that if in Gambang, they have to report to Dr. Naila. In Gombak, report to me. Then we will try. We are getting the information for Pago drivers who are handling the COVID positive cases there for the allowance, but it will not be permanent based on the presence of positive case which they manage at their own campus. Okay, this is the latest one. It will be effective on the 22nd April of 2022, the quarantine of close contacts COVID-19. For the close contact, tanpa mengira status vaksin, if they are asymptomatic, tak ada HSO dah, dalam tempoh 5 hari, dari hari terakhir pendedahan kepada kes positif COVID-19, kontak rapat itu hendaklah sentiasa memakai pelitup muka apabila keluar dari rumah. Means that there's overall they have to like self-isolate and try to avoid contacting with many people, but they don't get the EHSO anymore. But the kontak rapat bergejala dinasihatkan untuk melakukan kuarantin sekendiri, self-quarantine, digalakkan menjalani ujian RTK kendiri pada hari gejala bermula dan seterusnya pada hari ketiga. Jika mana-mana keputusan RTK adalah negatif dan gejala berkurangan, kontak rapat boleh melakukan aktiviti luar, termasuklah pergi ke tempat kerja. So I think that's about it for my presentation. I hope that is a new information and beneficial to the members of CFS community. I return back to the Mr. Chairman.
Okay, thank you very much, Dr. Siti Masita, for your insightful sharing. Right now, we will have a Q&A session with Dr. Siti Masita. So now I will open the floor to our participant either in Zoom or YouTube to ask your concerns or question or anything. So please ask your question. If you are shy enough, you can type your question in the chat box. Okay.
Assalamualaikum, Dr. Masita. SDH here lah.
Salam.
Just query lah, Prof. Dr. Masita. Yesterday also, I think YB Hairi also has been saying about the transmission. It says that R0 is already 0.9 if I'm not mistaken. And then the transmission is lower, and then they are reducing and so on and so forth. So when I look at the SOP just now, it's very similar to what we have been practicing. So I'm thinking, is there any other flexibility in coming into the next one? But then bear in mind also, like you mentioned just now, Dr. Masita, the after a year we are anticipating. But according to the trend is coming down. I don't know whether Dr. Adri is also online. So this is I'm thinking, because we are trying to bring back the student next month. So what will be the good number of students? What will be your constraint there? Is it? And then my question is, okay, because we have some situation, for example, in Kuantan, for example, some schools that I got in WhatsApp, it says that the PKD allow the parents to bring the student back to their home if they maintain the home isolation. Okay, so I want to know, for example, in Gombak, let's say the student, the student fell sick and then they went back. Is there any measure that we can control that? But in CFS, for sure, the student are not allowed to go by themselves. But in Gombak and Kuantan, they can simply say, I just want to go home and self-isolate at home. So is it allowable? For example, let's say student of CFS, and they contracted with COVID-19, and then the parents says that I want to take the student home. Wallah alam, these are some of the constraints. Thank you very much.
In Gombak and even in Kuantan, we allow the student to return home because if they think that
okay, thank you,
they are better being taken care of, especially in Gombak, dia ada budak-budak ni dia ada their own license.
They have their own transport and so on.
Let them.
Okay, thank you, doctor. Thank you, doctor. That's what I want to hear. Thank you.
Last time, usually I think because last time there was an issue that happens at the beginning of the COVID-19 operation yang mana dia sebenarnya PKD ke PKD ni yang bergaduh. Dia kata, why you transfer the positive case to our area? Macam tu, itu yang awal dulu. Sekarang dah tak ada dah.
Because I think the situation improved a lot now. But I think, like you mentioned just now, but we need to control it, definitely. So I'm thinking that self-isolation at home, I think is the best. Wallahu alam.
Yes. It is the best because it is also near the family.
Yes, definitely, Prof.
Well, we will see at this FS setting where the students are 17, 18 years old, so the family will be worried more.
Yes, definitely. They will be calling, what's happening to the children and so on. So I'm thinking, let's say it's positive, and then we call the parents, do you want to take care of your child? Then please bring them home. Allah alam.
But we have to remind them once
definitely.
you pick them up, there's a possibility that you will be contracting the infection.
Definitely, Prof. Definitely. These are some of the things. But I don't know lah. This one, I leave it to the bilik gerakan lah, Brother Samsul and Brother Tiffany Syam lah. But I'm thinking because we are already going into the endemic. I think so, isn't it? I think, and then the data mentioned by YB Hairi yesterday, I am looking at it as a positive thing. We need to live with the virus. In fact, I contracted the virus, the whole family last week. Alhamdulillah, after taking Panadol and so on. Although my wife is comorbid, actually, Prof. Actually, the other day when we measured the oxygen, at one time it was around 90, 89. I was a little bit worried, but Alhamdulillah. Although nobody asked me what happened to my family, Alhamdulillah, we survived. Okay, Alhamdulillah. What I'm saying is, it is there, but I think it is manageable. Wallahu alam.
That's why I mentioned when we are going through the transmission of endemic, we have to get the awareness to the level of individual. So kita kena we have to make sure the students is aware that it is their responsibility.
Thank you, Prof.
They are sick, they have to report. They are sick, they have to isolate. Bukan kita pergi mencari dia cari kita. We have to, to instill that awareness to them.
Okay, thank you, Doctor. Thank you, very good. Thank you.
Assalamualaikum, Dr. Siti Masita.
Waalaikumsalam warahmatullahi.
Thank you very much for your willingness and cooperation, sharing your experience, very important for us lah. Because why? Since that we are moving towards endemic, so we believe that we have to change whatever we are doing right now. So one of the things that we used to do during pandemic is for during the quarantine, for the quarantine of the positive case and the CC1 cases. Now, since that, yes, of course, as students, we allow them to go back with their parents, and of course, we cannot allow them to go back by public transport. Since that if any of the students cannot go back because why their parents cannot take them back, so we have to keep them in campus. So is it allowed because we are bringing in the maximum numbers of students, so of course the quarantine area will become limited. So is it allowable for us, for example, at the Mahalah Brothers, we just provide one level for, let's say, for the quarantine area for the positive case, because why? For sisters, we have no problem. We have one solid mahalah for quarantine and isolation. But for brothers, we have a limited area. So is it allowable for each mahalah brothers? For example, Abiruni, they have their own quarantine area. And Zarawi, they have their own quarantine area. Let's say we gazetted one level for the positive case lah. So then of course, we will do all the barricade, we put the security, because I see now is moving towards endemic, so this is my question.
Okay. Even though we are moving towards endemic, but bear in mind, if the positive case, you need to isolate at different block. Kalau close contact, itu lain cerita. If close contact is symptomatic, let them be in their own room. No need to transfer them out. Only the symptomatic you can isolate. Maybe you can do the level 1 and whatnot, level 1 of each block. But the positive case, you need to transfer out from that their mahalah, their own mahalah. Need to have a specific quarantine area because there has been an issue which being reported. The university, the students reported to KPT and also KKM, and which we have to answer because putting the COVID-19, the positive case even with the close contact. What more if you put the positive case with the normal, the unaffected student, nanti akan jadi isu yang besar. Nanti pening nak jawab nanti. Positive case.
Correct. The transmission is very high actually.
Kita tak campur, doktor. Kita isolate. But then we put them one specific area, doktor. We take them out from their room and then we put
barricade.
We isolate that area. We make sure that the toilet is separate from the healthy student.
Tak boleh, dia tak boleh the same. Bukan kalau dekat ground floor tu yang positive case, yang kat atas tu level 1, level 2, level 3 tu, the normal students unaffected cannot do that. You need to isolate to different block.
Okay, now we have one mahalah Abiruni. Of course, as you know that the setup of the mahalah in CFS is the block is integrated with one another, For example, block A, they can access block A to block B, block C, and block D. But then in Abiruni punya block, there is separation between block B and other blocks, which is we have a very strong grill separating block B to block C. So this grill, so we can lock this grill. As you know that previously Abiruni was a mix between brothers and sisters during our earlier days in Gambang campus, So that's why we put the grill to separate the brothers and sisters during that time. So now, can we use this method where we lock the grill and the student cannot access from block B to block C? And so can we do that?
If that's the case, boleh. Kalau ada memang proper barricade, bukan just barricade kita letak kita punya OSM kat situ ke, ataupun kita punya whoever that jaga dekat the entry dengan exit area tu. If that's the case, if we have like a barricade yang memang betul pagar betul, then it will be okay.
Alright.
Because it's more convincing. Memang tak ada mixing of the normal students and the affected students. We can give a try, but then if as much as possible, yang the normal room near to the COVID positive area, the entry dengan exit tu kita kosongkan. Boleh tak macam tu?
Okay, boleh. I think that's all for now lah from me.
Assalamualaikum, Doctor.
Salam, Tuan Mursyid.
Okay, just would like to, probably from your perspective, from your experience, okay, the practice in Gombak, with regard to assistance from KCDI to the frontliner, okay, especially Sejahtera Clinic, okay, you have also the council in facing this pandemic, right? In CFS, we have basically beside the clinic, the Sejahtera Clinic, okay, our task force, COVID-19 task force, chaired by Cik Taifun Hisham, and also our operation room lah, Sejahtera operation room, in which most of those manning, okay, these two council ni ataupun committee ni, they are not of course practitioners, okay, none of us are doctors, and in terms of experience, just based on what I was shared, okay, and as well as experience to the actual cases that we were facing. And of course, the number of students that you're going to have about 2,000 ni, so of course, assistant, okay, beside those already on the field, like the fellow, the principals, okay, assistant from the respective kuliah, for example, in the case of Gombak tu, they also having, their own committee assisting, okay, in terms of identifying the students, positive case and whatnot, because it always sort of macam an argument lah, okay, among those who are really frontliners, okay, in charge of these COVID cases, okay, with academic, for example, that basically teaching fellows, especially when the case happen at night, okay, during the odd hours, for example. In the daytime, office hour, normally it's okay. Okay, so there are always people available to assist students transferring from one block to the other for quarantine purposes and whatnot. But during night time, sometimes fellow, okay, in charge, probably just one fellow at a block. So sometimes it's beyond, okay, his control, okay, in facilitating the transfer of students here and there. So do normally people in Gombak, ask assistance from the kuliah, for example, people from the kuliah to assist them when really case is beyond control. So basically, that's my question.
All right. Even if beyond control, but our strategy is actually like we use fully the workforce of SLO. So even kuliah have their own SLO, Mahalah ada SLO, the administrative office pun semua ada SLO masing-masing. Answering to your question, after office hour, after at night, especially to transfer the student, what we do, because we see that sooner or later everyone will get the COVID-19 infection. So we told students, even the SLO in the Mahalah, the cut-off time to transfer to the isolation, the quarantine Mahalah is only until 9 o'clock. Whoever do the test after 9 o'clock, if it's positive, they have to stay in their own room. They have to inform their colleagues, the roommates, and we only transfer them the next morning because it's not urgent at all. Anyway, once they become positive, automatically all the colleagues in the hostel yang sama room dalam cubicle tu will be their close contact. So now the close contact, if asymptomatic, they can always remain in their own room. Dia cuma yang symptomatic saja we transfer out to the quarantine area lah. So means that if you find out that the students become symptomatic or fever and then they are positive at 11 o'clock at night, just let them stay in their room. The next morning baru transfer. Unless 11 o'clock at night, kata, sir, I'm having difficulty of breathing, I'm a bronchial asthma patient, itu definitely have to transfer out to the hospital. Itu kita tak boleh manage, memang kena hantar lah sebab dia breathing difficulties kan, but rarely we're going to get that problems lah.
Okay, since the doctor, you have mentioned about the cases whereby the student have difficulty in breathing, for example, in the middle of the night, kan? So then, of course, the handling will be not directly from fellow lah kan? Because why they are positive case,
Okay, if the positive case, they have breathing difficulties, the function of the fellow is actually to call the driver on call. So it has to be now, For all you know that I think everyone knows that in ISC we only have one driver. So we have to be human to the driver, because takkanlah every day dia kena on call. So this is where when we ask the VMU to help us, we have 4 drivers because the Gombak, the population is very dense. Maybe CFS can adopt the same thing. Maybe at least we need 2 drivers from VMU in CFS that we will assign them for COVID-19 operation. And these 2 guys will tag team with our driver in IC to take turns for on-call at night to stand by. Because this is the one that when we have the, we have the call to transfer the student, then these are the people that being called up and transfer the student to the hospital. And they have the right to get the COVID-19 allowance. So kita nak 2 je. Kita tak nak lebih, sebab nanti it is very difficult for us to justify with MSD. Because kalau misal kata they are just doing their works, drivers is dia punya tugas hakiki. But if we are assigned only 2 people, and then the 2 people have repeatedly exposed to the COVID positive students, transfer from yang normal mahalah to the quarantine mahalah, from mahalah to the hospital. So these are the guys we can justify, because using the 6 category inside the COVID-19 form study tu, yang the one that I showed you just now.
Yang the assigned drivers to doctor kan, they'll be using ambulance or the university transport?
Okay, they can have 2. Ambulance, if the cases is too many, they can even use the normal designated vehicles, not necessarily ambulance. Boleh dua-dua, but designated transportations. Maksudnya kalau misal kata CFS ada common transportation, ada van ke, ada MPV ke, you can assign 1 transportation for COVID-19 operation. Sebab yang itu yang kita akan repeatedly guna masa office hour ke after office hour. Sebab kalau ambulance ni dia boleh bawa 1 patient je at one time. If we have many, then we need more transportation designated for COVID-19.
Okay, Assalamualaikum Doktor.
Ya, Waalaikumsalam.
Terima Cita. Okay, so this is regarding yang tadilah transportation ataupun to transferring from the normal room to the quarantine room. Okay, so now we are planning ataupun we are relocated the quarantine center nearer to the mahalah lah. So it's allowable for them to walk in lah. Maknanya tak payah nak kita just arrange. Okay, if you are positive, then you can go to the quarantine center, take the key, and then you just self service macam tu.
Boleh kita galakkan. Itu kita punya gold standard for individual awareness. Cumanya the student, we have to make sure that the student report to the principal of fellow on call or fellow on duty, so that we know that they are inside the quarantine area. So this is the one that we want actually. They have the self-awareness, they know that they are positive, they are symptomatic and close contact to positive case. They just go to the quarantine area, take the key and they stay at the room. So we want that. Boleh sebenarnya, but they have to report and inform, sebab nanti we don't want another issue to develop that they are the the punya well-being is not being taken care of by the university. Kata sakit pun no one contact them, and then we don't know the case is exist. Nak report tak report, nanti kan takut ada masalah dia develop into complication. So at least the student report to someone lah. Be it klinik pun boleh juga, tapi we want the SLO of the mahalah or kuliah to know and take care of the students too.
Okay, alright. Thank you.
You're welcome.
Okay, any more questions?
Doctor, if you may, what is your advice lah, especially to the frontliner who has experienced all those situations, and in fact some become phobia. Okay, when you heard about student coming, I mean your advice lah. What we need to anticipate and what we need to prepare.
Okay, semuanya kena one is we have to prepare mentally that is going to be a spike of infection rate once the student return. So that's why we need the cooperation for everybody in this FS. Everybody have to work to make sure that positive, then everybody is make note on the SOP on the CFS. Where we would like to put the positive case for the students, for the staff. Ini kita kena supaya I mean the person voluntarily do the report and ask for help. Dia tak rasa kita tak nak, we don't want to develop a stigma that positive. Itu yang kita paling tak nak, because it's very difficult for us to handle. Once you get the trust from the community, they will voluntarily report to us asking for help. This is what happened in Gombak. Because they have the trust, once they have symptoms, kita kena ingat student ni, not everybody have a lot of money. They have symptoms, sometimes dia takut, nanti positif, nanti kawan-kawan semua habis bambu aku nanti. But if we have their trust, once they have symptoms, they even come, can I have a test kit? The test kit ni for the students is very expensive. RM5 satu pun, itu dah duit makan dia untuk satu meal. So, I mean, we will make it easy for them. Make it easy. They want to report, they want to go for the quarantine, they want to get food, I don't have money. So these are the well-being that we will take care of. Sama dengan staff. Bila dia positif pun nanti they are not being stigmatized by the colleague in the office. So nanti kalau bisa kata, oh positif, okay, you stay at home, tapi make sure that minta lah, they ikut all the procedure, they have to report to MySejahtera with EHO, SSO semua tu. So that we don't want the abusing of the system pula, itu another issue among staff. Itu kita tak nak lah. So we want to get the cooperation, we want to get the trust, but we have to be mentally strong that we have to bear in mind, even kena pun insyaAllah tak teruk. Itu je lah. So kita nak reduce the fear of facing the positive cases. So macam Cik Izdiha cakap tadi lah, walaupun high risk pun insyaAllah, so far Alhamdulillah for Omicron, we don't have any fatality case, be it among students, be it among staff. Sebab kalau untuk Delta dulu, we have a lot of, not a lot, we have mortality cases. I think about 5 untuk yang Delta yang dulu. So kalau positif pun insyaAllah dia tak teruk, but it's just that we have to make sure that we have to control the spread, sebab supaya kita tak bebankan capacity on the healthcare system and on the, kita tak nak kacau dia terganggu dengan proses pembelajaran inside the classes nanti. Nanti balik-balik positif dah tak boleh belajar. Kita tak nak pula timbul isu tu nanti. Parents mesti akan highlightkan isu tu nanti. Do we have on-call doctor? Okay. On-call doctor only for at least for the first week of the students returning. Sebab kalau on-call doctor ni kita ada 2 je doktor, nanti doktor tu akan kerja hari-hari, doktor pun akan stres. Bila doktor stres nanti dia akan makan orang semua. Jadi kita akan prepare for the first 1 week, then hopefully that we'll get a good cooperation from the SLO, be it in Mahalah, also in Kuliah lah, to take care of, to help us to take care of the students, especially.
Assalamualaikum.
Assalam.
In response to Haji Mushid question tadi, the information on the cases, how many cases available in the campus, can it be shared to the public? I mean, from students, lecturers, and other staff lah.
As much as possible we want to share, but we cannot. That's why we need to have the operation room. That's why we need to have one operation rooms. All the data is being centralized, because even you can see that some of other university are doing it. They expose the data to publicly. Later on, internally, memang yang university who expose the data publicly, dia kena bambu dengan setiausaha kepada Menteri KPT. It's not allowed. Even I have asked openly to the officers at the data management, because we have to report to the KPT weekly. I have put up the question there. We want to expose the data to our community, because we being pushed that the university has to be transparent to expose the number who are positive, who are being recovered from the COVID-19. No one answered the question, sebab we all know that it's not allowed. So tak boleh. So from time to time, this is the function of op room. Bila op room of each campuses knows we have one single op room that we cooperate among ourselves, then we know the data on our campus, then this is the data that maybe you can spread informally among yourself, but tak boleh put it into a table, put it into a poster, is not allowed by KPT. Sebab itulah kalau di KKM pun dia kata kalau nak tengok the positive cases for one nation, just tengok je dekat COVID now tu. So dia tak pergi expose on the media dah sekarang ni. Hari ni ada berapa puluh ribu cases, semua dia tak buat dah.
Okay, so any more question? Alright. So if there are no question, I would like to
last question from me,
okay.
please. Sorry, doctor. Last question from me, doctor. Hopefully last. Compared to pandemic and endemic, doctor. So when Gombak campus move during this transition period, from your average estimation, kan, how many percent that the workload have been reduced when you move to the transition period? How many percent being reduced? After that, we know the CC1 without symptom don't have to be quarantined, how much percent?
Okay, talking about workload is quite difficult for me to put it into percentage. What we can have now is actually we can get back to our so-called almost normal job specification that we used to do before the pre-COVID, at least, but not 100%, maybe just slightly near to the 100%. If we don't have the COVID positive, because the self-awareness is very high now in Gombak. We are so grateful because of the self-awareness, because they know that where to get help, what help they can have, what is their expectation. So it makes our operation a lot easier here.
Yeah, clear. Thank you very much, doctor.
Okay, doctor, there are one question from the administrator. The question is, do CFS need to come up with our own guideline, even there are already guidelines in IIUM Gombak and Kuantan? Can we just copy the guideline and adapt it with our own situation?
The answer is you can have your own guideline, but by adopting the Sejahtera Council guidelines. So it won't be so much different from the main guidelines.
Okay.
Because like I said, it have to cater to the community, because the CFS community, the range of ages will be different from the main campus lah.
Okay, so clear. So there are one more question, I think from Zoom, from Brother Rawyani. Okay, the question is, how do you or your team raise awareness about self-care or self-awareness?
By getting the helps from the SLO of all KCDIOM, because everybody get involved with the operation, everybody make known on the SOP and what to do and what not to do. So that makes the cooperation and the awareness is raised. Alhamdulillah, we got good support from the SLOs, all the SLOs in Gombak, in Gambang, in Kuantan. We got the cooperation from the op room, we got the data, and then because we have in Kuantan tu dicerita dia lain sikit because we have a lot of medical doctors there. In Gambang itself, we have Dr. Naila. I communicate with Brother Taifu from time to time. So it's also a lot easier, even though I know that CFS facing some difficulties, but inshallah, I'm very positive when we change a bit on the operation and the strategy, things will get a lot easier. Get the SLO involved, get the administrative staff involved, so that they are in the know of the procedure that we are doing. So we don't feel like working alone.
Okay, thank you very much, Doctor. I believe that so that we are in this together. So we need to work hand in hand collectively to make sure our campus is safe and our students and also our staff. Okay, so are there any more questions or concerns? maybe last question. Okay. So if there are no question, I believe we have come to an end to our first segment with Dr. Masita. Okay. Do you have any last word, Dr. Siti Masita?
I don't like to give last word, but I hope my wish to CFS committee members and community that even you have COVID, then don't be scared of COVID. You're gonna be okay. It's okay to get COVID. So thank you, everyone.
Okay, thank you very much, Dr. Masita, for your time and your valuable insight. Okay, so before we move to our next segment, we have a bit of presentation from our secretariat on the guideline. Okay, thank you very much, Dr. Siti Masita.
So I can leave now?
Yes,
thank you,
if you
Doctor.
want to.
Alright. Assalamualaikum. Ramadan Kareem.
Waalaikumsalam
Waalaikumsalam warahmatullah.
Okay, for participant, you need to stay in line. Okay, until we start our next segment at 10:30. Okay, so let's enjoy our presentation first. Okay, as of right now, we are waiting for our next speaker, Assistant Professor Dr. Edri, to join our session. So, inshallah, we will start shortly after the speaker has joined. But participants, please stay in line. Okay, Alhamdulillah, we just finished our first session. Now we will move to our next segment. Okay, now I would like to invite our next expert or next speaker, Assistant Professor Dr. Edri bin Muhammad Aidid, the head of IIUM Kuantan COVID-19 Operation Room, to share his thought on the future direction in handling COVID-19 during endemic transition phase. Please welcome Dr. Edri. The floor is yours.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Can you all hear me?
Yes, Dr. Ede.
Okay. Thank you, Mr. Chairperson, for the kind introduction. Okay, let me share my screen first. I have two parts for my session, my slot here, which is the some background on the current management and the new upcoming management, and some demonstration on the new management. And lucky for us today, I have my deputy, Dr. Ashraf, who is joining us, and he will continue with the second, the next segment, which is the quarantine request. Okay, I'll share my screen first. Okay, can you see my slides here?
Okay, yes, sir.
Okay, right. Okay. Just a brief introduction. I think just now the first session, I think most of you have known, okay, the reason or the importance behind fasa peralihan ke endemik. Okay, fasa peralihan ke endemik. As the name implies, fasa peralihan ke endemik, okay, or the transition to endemic is not purely endemic phase. Okay, endemic means stable, naturally occurring, and it is in a controlled environment. Okay, now we are in transition phase. So in transition phase, we still have to follow our SOPs and our precautions, because in other parts of the world, we still can see a rise in number of cases. We can still see the rise in the number of deaths. Okay, especially in countries where there's lack of vaccine, there is vaccine equity issues. Okay, in vaccine, they do not have adequate vaccines to vaccinate the people, and thus hence predisposed to more severe disease and subsequently death. Even in developed countries, or countries that started to have their own vaccines, also are having trouble now. Okay, example is China. They are using the Sinovac. They are not Sinovac and CanSino and other types of locally made vaccines. They are looking at a rise in number of cases. All right, that's why they locked down the country. Okay, as opposed to us, we have combination of vaccines. Okay, we have Pfizer, we have AstraZeneca, we have Sinovac and other types of vaccines available, and also our good booster vaccination program. So in other words, we still need to prepare ourselves. Okay, these are the criteria. If you look at this one, the criteria on the left is the national level. Okay, there are actually 7 things that we need to look for, and also IIUM guidelines. Okay, I would like to highlight here the point number 7 at the national level. Okay, if you look at the point number 7 here, okay, the point number 7. Wait, I don't want to draw. Okay, so here we have the duta-duta community, mendidik masyarakat amalan and langkah-langkah keselamatan. Very important point, very important point here that I want to emphasize. Okay, kita kena perkasakan masyarakat. We need to empower the people, empower the leaders to inform the public or the community to empower themselves to take care or take charge of their own health. All right, that's why we have a digital health surveillance order. Okay, so if you become positive, you need to isolate yourself inside the room, inside the house. You report to MySejahtera, and you do precautions to reduce the risk of giving the COVID to other people. Okay, pakai mask, sanitize yourself, and complete the quarantine measures. All right, so very important point, duta-duta community. So even in the IIM guideline also emphasize what are the things that you need to do. You still need to follow the SOPs, the general SOP, distancing, ventilation, cleanliness. So I think one of the misconception is regarding apa yang boleh buat, apa yang tak boleh buat. So most of us know that COVID is still a risk. Okay, tapi when we look at the government's initiative, somehow reduces the number of SOP, but it's not really reduce the things that you need to do to protect yourself, tapi it more towards feeling empowered, okay, feeling responsible towards yourself. Kalau you have symptoms, please don't attend events that involve large gathering. Okay, if you have symptoms typical of COVID, please test yourself and isolate yourself. So these are the key points that is needed for us to understand in the fasa peralihan ke endemik. Okay, so because of that, we find that in example in Kuantan campus, we find that after reaching almost complete 3 years of COVID-19, we find that most people already know what to do. Okay, the things that has been changed is only in terms of the quarantine period, in terms of the severity, all right, of the current variant. Okay, now we can see more mild cases. So we need to empower ourselves. So we cannot just rely on the staff to do contact tracing. We cannot just rely on our healthcare system, okay, the clinic, ISC, FSC, SUSMEC, to do all the contact tracing. So that's why the government imposed us to report in MySejahtera. So in UIA also, we ask the staff and students to also give information so that we can report to the Ministry of Higher Education, right? So in order to achieve this, we at Kuantan level in COVID-19 operation room, we have discussed with the stakeholders. We listen what is the shortfall of having very intensive contact tracing, a very intensive reporting by the staff. Okay, so they feel that it's not really reliable anymore. Okay, now the person need to take charge. So we have an objective to complement the MySejahtera system by having our own database or our own digital application, mobile apps to serve purpose number one. Okay, I'll explain this in a while. So in order for us to run this, we need to do some pilot testing, we need to do some validation, and we need to ensure that people know how to use the application, just like our MySejahtera, not trying to replace, but to complement whatever inside the MySejahtera. So what is actually the app is? So here we call this as the new management. Okay, new management that is going to be changed from the old management. Okay, but I need to erase this first. Okay, so it's called Digital Epidemic Detection and Action. So we in COVID-19 operation room in Kuantan campus, we have worked together with developers. Okay, our developers consist of software engineer as well as medical doctor to try to have our own database inside one apps. You don't need to open multiple desktop, multiple devices. You can just access one software or one system to check your status as well as to do the quarantine procedures. So the key word here is self-declare. So when the student is positive ataupun ada symptoms ataupun even the staff ada symptoms or positive, self-declare inside the app. Just like MySejahtera, you need to update first your MySejahtera and fill up the quarantine. So the student yang positive still need to undergo quarantine according to our guidelines and follow the MySejahtera duration. Kalau 7 hari, 7 hari. Kalau 10 hari, 10 hari. So they can, we in as the stakeholders, we can just monitor the apps. So it's like something like booking in a booking hotel. We'll show demo in a while. So basically, that's the main purpose of this new system. So everything you can check inside the mobile application. All right. If you look at my left side here, this is just a demonstration. So when you are COVID positive, you can open the form and place in your request. This one, Dr. Ashraf will explain. And then you can monitor yourself, especially the students. They can monitor. Okay, what time that they can enter the quarantine center, what time they can use the transport. If let's say you have ambulance, pukul berapa kena pergi ke designated site and go for quarantine. So they can check themselves. Okay, there's no need for kuliah task force or the department to do all of the reporting. Okay, so regarding the quarantine isolation, because it's still under Act 342 atau Artikel 42 penyakit berjangkit, we still need to have some sort of mechanism to quarantine and also isolate. All right, because they can spread the disease, right? So here in Kuantan, we have close contact punya quarantine. We have the floors, the dedicated floors for close contact CC1. And if needed, kalau banyak sangat, we can move to Maimunah. Okay, maybe in CFS, slightly different setting. For positive, we dedicated one block for positive cases. So positive cases can share rooms. Close contact, usually we opt for single rooms because we do not want them to have those who are non-close contact to be mixed with the close contact. Okay, so what happened in Kuantan campus is actually previously we rely on kuliah task force. Our task force for each kuliah, representative from kuliah, to do the contact tracing. Kalau ada case positive, how many close contact? So they need to check who comes into contact, what is the duration, pakai mask ke tidak. So it's very tedious. Okay, same goes to the transport. The kuliah or the kuliah is the one that requests for transport. Okay, kalau student tak ada transport, they don't have their own transport, they kuliah will request for ambulance to transfer. Same goes to the quarantine room. Now we empower the individual themselves to do their own status check, do their own request, do their own checking of the quarantine room. And for the positive cases also, previously the reporting is done by kuliah. Now we focus on the person. Same goes to with the MySejahtera. We also report the status because we still need to report to KPT. KPT does not take information from MySejahtera, but they keep information coming from our clinics as well as from bilik gerakan. So that's why individual will report the case, and we at the operation room at least will monitor, and kuliah also can monitor the students and so the staff regarding the reporting. So more towards empowerment of the people. So that's what we want to emphasize. Okay, so the advantages is 3. This will reduce the efficiency by reducing response time. Okay, so student can do and kuliah can monitor, and COVID operation room can monitor if let's say COVID operation room still exists. All right. So if let's say it's all okay, then kuliah can just monitor. But all of the things are done by student and staff to report. Okay, and the mahalah as well as the transport just need to assess the sheet and to give the time where the student can go and enter the quarantine rooms or quarantine mahalah. So this will reduce the multiple workload and also improve the quality of life of everyone. So there are some things that we need to consider before we implement this. All right. basically the trust and monitoring. We need to trust the students, the staff to do their part in the COVID management. This is the spirit of the endemic transition phase. Number 2 is accessibility, because we developed these apps actually for start off with the Android, okay, the non-Apple user, but we extend this to web app, the web version that can be also installed and accessed using iPhones, all right? So hopefully everyone can use these apps. We have done some training, content and technical validation, okay, in Kuantan campus. However, number 4 is very important because there are some things regarding data. Okay, we have declared that this app actually does not collect your own personal data. Okay, does not transfer inside any cloud service unless it's requested. Okay, unless you are close contact or positive, then the management need to get your information. If not, inside the phone, the data will be stored only inside your phones. But this one needs some verification and black and white. So we will present this in the UMC meeting next week, inshallah. Okay, so for CFS level, because as start, we developed this app using Kuantan campus model. So it's possible for CFS also to use this app. There are 3 things. Okay, I have communicated with the Bilik Gerakan for CFS. So one is the reporting. Okay, reporting for KPT, okay, ke our MOHI. So we need to have a link to report the cases, Google form. We also need to have a Google form or a link for quarantine matters, quarantine issues, and also some data studio, the statistics of the cases. So the links are needed, and we can try to inform and also integrate inside the mobile apps with the developers. Okay, I'll go to the hands-on. Okay, let me open first the apps. Okay. Okay, can you see? Sorry for the. Let me open one slide here. Okay. Okay, can you see this center, my center console here? Okay. This one is called Digital Epidemic Detection and Action. So this is the name of the apps. So when you get access to the app, you need to sign in, right? So you can sign in using whatever account that you have. And it's only kept, dia hanya simpan dalam your punya account saja. Okay, not transferred anywhere. So let's say I put myself, okay, my account here. All right. So you need. So this is the interface. Okay. So this is the interface. You have the button here to check for the your profile. Okay. Example, your profile. You need to select first whether you are a healthcare worker. So if you are working at the clinic, so the risk assessment, everything follows Annex 21, our guideline untuk healthcare worker. Kalau you are student or staff, it will follow the KKM guideline for the public. So you choose one. Okay. Example, I choose student. Okay, I choose student here. Example, I am a student, so I need to fill up every data here. Vaccination, demographic. This one is only keep inside the apps. It does not send to anywhere. So after you have entered everything, every information here, you can submit, and your profile will become a student profile. So in student profile, you have some additional buttons not found inside the healthcare worker and also staff. So kalau student, dia ada quarantine request kat sini. Okay, I go example, one example. Here you have the quarantine assessment, quick assessment, sorry. You have here in the home, kita ada the status, what status you have. Let's say you are healthy, then you can just change and clear the status to become healthy. Okay, so the last check is here. So let's say you are in contact, you are in contact with the student are in contact with a positive case. So dia kena isi quick assessment button here, right? So below here, we have the quick assessment button. So in quick assessment button, we have either 3 options. Kalau sama ada you are actually COVID positive, symptomatic, ada symptoms, ada gejala, ataupun you are contact with COVID positive case. Okay, let's say the student are contact with the COVID positive case. Let's say dia jumpa kawan dia, which becomes positive. So they need to answer some questions. So these questions, we follow the standard KKM protocol. The standard KKM protocol untuk close contact adalah berdasarkan KKM COVID-19 protocol for close contact. So sama ada the person becomes close contact ataupun casual contact. Casual contact does not require any quarantine. Close contact depends on the risk. Okay, depends on the vaccination and also booster level. So the screening question, let's say the students have contact more than 50 minutes, yes. Contact within 1 meter distance, yes. Not wearing mask, okay, or the contact not wearing mask, yes. So the status will become close contact. So inside the app, we have made in a way that it will cater for our needs inside the campus. So let's say the person becomes a close contact. What should I do? He or she needs to follow the IIUM guidelines for close contact management. All right. Let's say the student is having symptoms. Okay, having symptoms. Not receive booster. Okay, not receive booster. Only fully vaccinated but symptomatic. So the person need to, the student need to quarantine for 5 days. Right? So the student need to quarantine for 5 days. Okay, so the first step that the student need to do is he or she need to open. Okay, open MySejahtera. Okay, so update the MySejahtera. Okay, I close this one first, just a demonstration. Open and report the MySejahtera, okay, as a close contact. Kalau dia positive, he or she need to report the positive case. All right. So that's one. Afterwards, the student need to fill up the quarantine request form. So this is the form that needs to be filled so that our transport unit, our mahla can prepare the rooms for quarantine, for single room, for close contact. Okay, so some notes here. Why do we say that we want to empower the student or the person for tracing or to inform their contacts is because we have put here, you are advised to notify the person who you are in contact 2 days before you tested positive. Okay, or the person tested positive. Okay, let's say you are a positive case. All right, so this one is for positive case. Kalau close contact, let's say you have become positive before, according to KKM guidelines dan juga UIA punya guidelines, in the last 60 days, you don't need to quarantine. Okay, so close contact were fully vaccinated, in the last 60 days, have COVID, do not need to quarantine. So tak perlu nak isi form quarantine request. But let's say, if tak pernah dapat COVID within or more than 60 days, and fall under the criteria that needs quarantine here, then they need to fill up the quarantine request form. Okay, so this one Dr. Ashraf will explain. Okay, regarding the quarantine request form. Okay, so after the student or staff have done this, they will click understand and close. Okay, and the status will become close contact. All right. So what happens? Okay, let's say the student have become close contact here and have filled up the form just now. So the student can monitor what time that they need to enter the quarantine center. So we have our database here. Okay, so this one, this database will be explained in more detail by Dr. Ashraf later. So we have the timing, the duration. The duration of the transport that will transport the students or staff for close contact. Let's say some of the staff also, sometimes the houses are not suitable for quarantine kan. So kadang-kadang staff dia nak tumpang sekali dalam quarantine center. So they also can request this. So for students especially, they can look for the transport time and transport date and where to pick up. So this one will further explain after this. So that's briefly what the app is. Okay, I'll open back the apps. Okay, what else that is contained inside the app? So here we have the tutorials. The steps that I showed to you just now. You can access the tutorials here. If you click here, detect tutorial, it will tell you how you want to do the steps to do the assessment. Okay, step by step. Launch the app, layout. If you are positive, what to do? You can easily see inside the app. Okay, what to do, and go step by step and follow whatever status that you have here. Okay, same goes to the just now where I open back the apps.
Skrin putih je, tak nampak.
Yeah.
Dekat skrin tu putih je, tak nampak ni content.
Skrin putih. Kejap.
Okay, thank you.
Boleh nampak sekarang? Boleh nampak dah sekarang? Tak nampak. Okay, let me stop share and open share balik. Okay. Sorry for the technical ni. Kejap Saya open balik ni. Okay, can you see the app now?
Nampak.
Sorry, saya kena tukar background tadi. Sebab the apps, if you open inside the browser, dia jadi kecil. Dia jadi kecil. The apps is made to use in mobile phone. Kalau use in mobile phone, dia tak ada masalah nak see lah. Tapi kalau dia open inside desktop, you need to minimize it so that dia akan more or less looks like dalam mobile apps tu sendirilah, dalam your phones. Sekejap, saya tunjuk balik. Okay. Alright. Apart from that, okay, kita ada quarantine request. Dr. Ashraf akan Dr. Ashraf punya site tu will explain in detail lah what is quarantine request and how to do. Right? So you can easily access inside the app. Okay, what are the other things that you can search for? We also have some infographic you can search and you will look for the trees infographic and also some educational videos. What is COVID-19 is all about. All right, you can the information relevant to COVID-19. So that's the concept of the app. We want to empower and to complement whatever inside the MyChatera lah, so that kita boleh tengok and also monitor the students and also staff easily lah using one apps. The last button that I want to show here is the statistics. Statistics here is the one that the statistics for the campus, right? So in quarter campus, I think in CFS also you have the statistics kan. So that's why we request kalau CFS nak guna, you can use this data studio dashboard. Just get the link and give to us. Then we try to integrate inside the apps. You can see the status of the cases in the campus. Okay. So kalau kat campus kat Kuantan pun now alhamdulillah going down trend, right? Going down trend. Kita ada peak dulu masa February, end of February to March. Masa Omicron, dan alhamdulillah so far so good lah. So far so good insyaAllah. Okay, coming back to the apps. Okay, coming back to the apps. I think one more demonstration untuk staff. Let's say you are staff. Okay, let's say you are staff. You need to change. Tadi you click on profile, you need to change. You are a staff. Kalau if you are staff here, you don't need to let me. Okay. Okay, if you are staff, you don't need to request for quarantine because basically you are quarantine dekat rumah kan, quarantine dekat rumah, melainkan ada keperluan untuk quarantine dalam kampus lah, special case. So dekat sini, let's say we clear the status, right? You do quick assessment. Let's say you are COVID positive. You have symptoms, sesama, batuk, demam. Okay. So and you test RTK positive. Yes. Right. So your status will change to COVID positive, and you need to update your MySejahtera and fill up the reporting form. Tadi untuk students kita ada quarantine request form, which dia serve two purposes. One is quarantine request, and another one is dia akan terus cater for positive case juga, reporting of positive case. So the link here, if you click on the link, it will open to you the pelaporan case positif COVID ke KPT. So link ni akan diisi oleh student ataupun staff. Staff lah, in this case is the staff. And for us, operation room or the clinic will verify whatever information that has been given in order for us to report to MOHI. That's why it's important for us to have the system because we still need to report to MOHI. I think Dr. Naila punya team in ISC in Gambang are doing the reporting lah for CFS, right? So that's the importance lah of reporting the cases, right? Okay, coming back here, there's one more risk assessment that you can do. If let's say you are symptomatic, you tak tahu lagi you are close contact ke positif, tapi suddenly you have symptoms. What is the symptoms? Any of the following lah, fever ke, cough ke, loss of taste or smell. If let's say you have tested, and then positive, then you report as positive. If let's say you are symptomatic, and then you are tested negative, then it will prompt to the user that you should receive health treatment to the nearest healthcare facility. Sebab yang ada simptom tak semestinya COVID, tapi still kena confirmkan. Kalau the doctor, example in ISC ataupun dekat any clinic, suspect you are COVID positive, then maybe need to do repeat RTK ataupun confirm by PCR straight away. Okay, so that's the reason why we put here. And also follow the MySejahtera health assessment tool. Okay, let's say you are symptomatic, you are symptomatic, ada symptom, tapi not done any tests, so the apps will stop blinking. So the apps will trigger that you need to do an urgent test. Okay, so that it will alert that the user to do testing lah. Bukan hanya duduk tanpa test apa-apa kalau ada simptom. Kalau tak ada simptom, then should be okay lah. Okay, that's the simple description of the app. For healthcare worker, let's say I set this as healthcare worker. Okay, let's say Dr. Naila punya team lah inside CFS want to do the screening. So the team, the clinic or the healthcare worker can use this template as well. Example, kalau COVID symptoms or positive, samalah, kena the management is similar dengan COVID positif punya management. Tapi kalau dia close contact for healthcare worker, dia slightly different. Okay, even the question also slightly different. You have COVID symptom or not? Yes. Wearing the source person wearing mask or not? Do you wear PP or not? Okay, let's say no, become high risk. So in high risk, this guideline will follow the guideline for the management of healthcare worker, Annex 21A. So this app can also be used for healthcare worker. Okay, so straight away the doctor or the staff, the MAs or the nurse will know what to do. We need to do RTK at day 3, advise to repeat RTK at day 5. Okay, after RTK return negative, you can go back to work. All right. Okay, I think so for my part, that's all. Okay, I stop share first. Okay, any you want the questions and answer, I think we reserve after Dr. Ashraf punya slot. Is that okay?
Okay, yes.
Okay. So that we have more time lah to discuss anything. Yeah, Dr. Ashraf, are you prepared to continue?
Yeah, sure. Bismillahirrahmanirrahim.
Okay, right. Thank you.
Let me just, okay. Assalamualaikum warahmatullahi wabarakatuh. Thank you so much, Dr. Adri. Inshallah, allow me to share my screen. So I'll try to, I think this one, maybe desktop, yeah. Okay, so I hope you all can see my screen. I am sharing the quarantine dashboard. How do I get rid of this? Can you all see my screen?
Yes.
Boleh, Okay. So this is the quarantine request dashboard that had been mentioned by Dr. Adri. And this is the tab that you will be able to see when you are as the student. And so this is widely accessible. As at the same time, the students can also access the quarantine request form. So these two things are the ones that can be accessed by the students. And then there is another one, Google Sheet, which can only be accessed by the, how do I get rid of this? By the admin. So this is something that the admin can access. And for example, the mahala as well as the transport unit. So we can see here that we have some dummy information. I think some of the participants here, thank you very much for filling in the information. So I'll show you later on how from the form they are being they are being transferred here as the response. And from this response sheet, we have additional information that we will key in by the mahala as well as the transport unit, which will later on be automatically updated to this dashboard. And we have time frames that needs to be followed, whereby all the information will be updated by the respective people. So I'll show you a video which will also be as the one that had been mentioned by Dr. Adri. So the students also can access this video and actually can always have a walkthrough. Okay. So we'll go one by one. So this is the quarantine request video. Okay, so the students will need access to these two information or these two resources, as I mentioned earlier, the quarantine request form, which is they can access it through the DTech apps, as well as the quarantine request dashboard. So whenever they are prompted to fill in this form, so this is what they will be seeing. Okay, so the first step, they need to complete this form. So fill in and submit the quarantine request form, and automatically what they need to do is they need to undergo temporary isolation in their current room. At the same time, they will have to stay alert with the updates in the quarantine request dashboard. So the first thing, so they will have a look at the quarantine request dashboard and make sure that their request is already it appears in the table. So they will have a look here, and some of the information will not be there yet, which is the quarantine room, the transport time, the date, as well as the pickup point. So these will only appear based on the schedule that we have decided. So which is also contained in the information that we provide. So this is the first step. So once they have already request, they check the request dashboard. At the same time, they are at that particular moment undergoing a temporary isolation. Okay. Just some technical things. In the dashboard, they need to make sure, this is a zoom in into the dashboard. This arrow is being showing downwards so that all the list shows the one that are most recent requests on top. Right. So this information contains all those, not all actually, some information that are important that are being extracted from the Google response sheet, which are data input by the students. Okay, the second step, this is where the administrators come in. So step 2, the Mahala management will assign the quarantine room. There is only 2 time points where they will assign or update the information. And these time points are being shown in the tables. Sorry, let me just pause this first. So it will be shown in the tables. And if you can see here that it's 9:30, and this is one of the time points where the Mahala team will update the quarantine request number. And this is important because usually the Mahala team have their own schedule to check whether there's room empty and so on. So that's why we have this schedule, and these are all being upon the discussion with the Mahala team. Now, if the request time of the students is beyond the cutoff time, so actually these time points are being mentioned here in the dashboard also here. Let's say they have requested at 9 o'clock, 9:45, and the cutoff is 9:30 for the processing of the application. Then their assignment of the quarantine room number will be given to another time point. So they will then have to be under temporary isolation for a bit longer, but that is okay, inshallah. So now at say 9:30, so this student is now accepted for the first to update for their quarantine room number. So what they'll need to do is, once they have identified room number, they start to pack their belongings and still be on standby. Just play again. Okay. So still under step 2. So for those students who request for university transport, they will need to wait for the information for the transport time and schedule or pickup point. So that will be in step 3. I'll go after this. But for those students who request self-transport, in that particular form, we have an option either for self-transport or request for university transport. For those who have already requested self-transport and they have received the quarantine room number, then they can immediately go to the room for check-in. So the Mahala team knows about this, and so they can immediately go, and there are other forms that in the Mahala that they need to fill in. So step 3 now is for the administration by the transport unit. So this is also data are being updated according to the schedule given. So all of this is important because we want to have a proper management of expectation. So the student knows when they need to check the dashboard, and then when they can be transported and so on. So all of this at the same time also facilitates the task force. Before this, they have been ongoing looking at checking their phones, I think up until late night. But now they know the time points that they should be checking all of this information. So that's among the improvement, inshallah. So the transport unit will provide the transport details. Similarly, at 2 time points, the transport details include transport date, the transport time, and the pickup point. So the pickup point are data being extracted by the block of that particular student. So the student has to key in their the block number. So the transport unit will then reconfirm that as the pickup point. And the students are being informed so that they will be present at the pickup point 5 minutes before the time that had been allocated. So this is, for example, the arrow previously showed that at 10, that is the time whereby you can't really see this is too small, but that is the time where the transport unit are obliged to update the information. Okay. So transport time and so on. So step 4, this is now the transport time. In one day, there is only 2 trips for each category of risks, which is the close contact or the positive case. So for the close contact, let me just make this finish. So for the close contact, trip 1 is at 12 p.m. Trip 2 is 4 p.m. Positive case early in the morning, 10:30, and later at night at 8:30. So those these 2 is the 2 trips for these 2 category of COVID cases, COVID-related cases. Okay, so I think that is the overview of the process. I'll go into the details of the materials, but I'll still have some time. Okay. Now, I'm not sure how I can remove this bar. Okay. Okay.
Dr.
So
Shah,
this,
sorry, you can click on the view too. Click view yang blue colored button on the top right.
Oh, yeah. All right.
Okay.
There's this bar showing here. Do you see something blocking on my screen? A black something?
Tak ada.
Or everything is okay?
Okay.
Okay. So because the panel here is blocking a bit. Okay, so now we are now in the quarantine request dashboard. And you can see that this information we started just now at somewhere 11, I think somewhere here. This is from here, I think some of you had already keyed in the response. Now you can see that this is what the students will be seeing. Their request is being accepted. It's already shown here. And then the quarantine number is not assigned, so it says now, transport date now, and up until the pickup point. Okay, so now let me just show you the quarantine request form. This is, I think this we need to go through, but I don't want to go through together. I'll just go briefly. This is as an admin view, so I can just scroll down some of the questions. For the close contact quarantine, we can, the among the questions is that they need to understand the quarantine procedure, how long they need to quarantine and so on, because they will provide the quarantine release day according to this particular schedule. So they need to agree to which they understand to this procedure. Now this is if it's positive. Just bear in mind that if it's in the view of the person completing the form, it doesn't show up if they say that they are positive. This is just because I'm an admin, I can see all of it. Yeah. So it will ask the question whether, let me just fill in. Tak apalah, lambat nanti fill in. I'll just go through very quickly. So we'll be asking about COVID testing, some personal information, mahalah, the block number, their vaccination status in this format. So they show these are all data important. You might not be seeing it in the request dashboard because that will be a bit more confidential. Even we can only use the metric number here in the dashboard. The rest of it is also data that will be extracted for the KPT reporting. For example, like this one. So we will also be asking whether they have symptoms, date of symptoms started. And here is the key question, whether they have their own transport or they would request for the university transport. Okay. Now let's go to the admin sheet. So this is the quarantine room request admin master sheet. The master sheet that is being shared only to the administrators, particularly the mahalah team as well as the transport team or transport unit. Now this is the data. I think I'll start from here. Sister or Dr. Azza has requested as a close contact, and then metric number, the kuliah, and so on. There are also some who declared as positive. Okay, so these are some of the information. I don't want to go in detail. I don't think it's related here, but this is day of quarantine release. The students fill in this based on the information that I mentioned just now. These are color coding. I mean, even the positive color here is color coding to show the colors. This has been requested by the Mahala. They wanted to have color codings for efficient management. These colors here indicates the status of the case. So yeah, green means that this has passed the date. For example, 10th this year, Noro Haida, 10th of April. So this person has already been released from quarantine. The red color means that it is active case. So the student is still in the quarantine center. Yellow, this one, orange means that it is the schedule for release today. So this is 15, right? Today is 15, yeah. So this is based on the formula that we have added in the Google form or the Google sheet. Sorry, the Excel sheet. Now, this is where manual input is required. So at somewhere 20 minutes or even earlier, the Mahala will check this master sheet. And they need to do this 20 minutes before the first update schedule that I've shown you earlier on. So for example, here the Mahala has seen that there's new request. So they will put the request. For example, let me just put some numbers. Mahala number. Okay, so initially you will see that there's none, but now I'll put here's some numbers. So yeah, this is the Mahala quarantine number. And if we can see here, it is already appearing for the ones. Just I did the input here. You can see that the quarantine room number is already being updated automatically. Now the students can actually see this even before the time that the Mahala updates. For example, we schedule at 11, but if the Mahala team did it earlier, they can actually see that it appears. So now transport team will then also see the information. So what they need to do. So the blue color is for the Mahala team. This one self-transport. Let me just do this one. I'll just copy paste some numbers. And then this is the time points, 8:30, and F7 is the pickup point, which is actually not correct based on this. Yeah, I should take from the blog, but yeah, just for the purpose of this demo. And then you can see that the information is updated in the dashboard. So the student will actually need to check at this time point, but you can automatically see that if the Mahala team made it more earlier, they can actually expect that their transport time will be scheduled at this time. So they can wait and prepare their belongings. So I think that completes the whole process of this quarantine request. And then once they have completed their quarantine, there will be no request for them to go back to the Mahala because in IIUM Kuantan campus, the transport unit has scheduled for shuttle bus around 30 minutes. Every 30 minutes, there will be one, inshallah. So these students are already free from any risk, inshallah. So they can either call their friends to pick them up, or they can use the shuttle bus, or if it's a walking distance, they can do so. So that completes the whole cycle, inshallah, and to keep our campus safe, inshallah. I'll pass this back to you, Dr. Edri. Thank you.
Okay, thank you very much, Dr. Ashraf. Okay, in the chat box, I have shared to you the tutorials for our session today. So the use of the app as well as the quarantine request tutorial. So please feel free to watch and to learn about the system first before actually we implement this. Okay, inshallah, hopefully semua berjalan lancar and we can use this as soon as possible. We are still waiting for green light from top management. Okay, I think for our sharing session, I think that's all. Any questions from the members of the members of this session?
Assalamualaikum, Dr. Ashraf.
Waalaikumsalam.
And everybody and Dr. Adri as well. Yeah, thank you so much. I think this is beyond excellent. Yeah, if you can have such an app to monitor, that would be helpful. My concern is since we are migrating from Google to Microsoft, right? Is it a good idea to store our data to Google Studio or using Google products? So should we consider migrating as well to Windows Microsoft? Yeah, that would be my concern.
Yeah, honestly, we really haven't gone through that in detail. But just to answer that, I don't think the information, these data would consume too much space, especially for the Google form and the Google form that we are using. The owner would be our Kuantan campus email. The operation room campus email. We'll change that, and inshallah, it wouldn't take so much data. So unless our account is beyond the 15 gigabytes, but just for the practice of this one, I don't think it would take too much information because we don't ask them for any photos of, say, before this we did have when we wanted to see proof of the RTK and so on. But this time for this quarantine request, we only ask for just numbers and so on, for just deep information. No photos, which would consume a bit more space. So at this moment, honestly, we haven't thought of that, but this is the most convenient. And inshallah, we think we will proceed with this. If we stumble across any challenges, we'll try to figure it out after this. But yeah, thank you for raising this question. But at the moment, this would be the one. If you have any other more effective way, I think feel free to do that in Gambang. Thank you so much.
I think this is quite effective. It's just a concern. Thank you so much.
Yeah. Thank you.
I would like to add a bit on Dr. Ashraf. Basically, the system works when we can display our monitoring system lah. In this case, our monitoring system adalah dashboard. Okay, kita ada dua dashboard. We have quarantine dashboard. We have statistic dashboard. If Microsoft is and also the members that have the expertise to develop the dashboard, to show the statistics and to show the quarantine, then it's possible to migrate everything in Microsoft. Okay, if let's say this method cannot be used, cannot migrate the dashboard, okay, the what to show inside the quarantine and also statistics, then maybe need to stick with Google.
Okay, thank you, Dr. Adri.
Okay, any more question from our participants to Dr. Adri or Dr. Ashraf? Okay, for those who are in the managing the student quarantine, especially.
Yeah,
Assalamualaikum. Just to ask, where can we get this app? And then who can actually monitor this app in, let's say, in the FS level? So can fellows or principal RDW can have access to sort and look at all the database? Or
okay, for the user, all of the community, okay, the university punya community can access the app once it is officially released lah, alright. Once it is officially released by and also agreed by top management. Regarding the administrative, what Dr. Ashraf have mentioned just now, basically we share the sheets, kan, Dr. Ashraf, we share the sheets with all of the stakeholders, mahalah, transport, security, everyone that involved in the management.
Yeah. So we will share the master sheet, which needs to be duplicated, which means to save as another copy, because the apps itself. Yeah, I think Dr. Edri had mentioned earlier on that we need to have a separate link and so on. These are all a bit technical. So we will not be sharing the same link and the same master sheet, because that will cause a lot of trouble. As well as the dashboard. So that needs to be a totally different set of dashboard, which syncs to the master sheet and as well as the Google form. So that thing, that will require another session just with the administrators. But the rest, once you have that, all those are being shared by whoever the Brother Samsul's team decides. I think that one would be their authority. So, but to be effective, whoever has some authority and needs to manage needs to have access. For example, in the mahalah, their fellow di mahalah, I can't remember apa dia panggil tu, mahalah office.
MO.
Yeah, the MO mahalah officer. For example, Brother Taufiq apa semua tu. Is the ones who have access. So that is maybe can respond to the question just now.
Okay, any more question?
Okay, Dr. Ashraf and Dr. Edri, thank you for the explanation. I think we have discussing through Sister Azhar for the past few days on how we want to custom into Gambang campus. So I think is what they call it. I can say premature that insyaAllah kalau Kuantan dah approve, then Gambang will have this. Premature dah semua lah, tapi still we are working together with Dr. Edri and Dr. Ashraf to link some of the database, some of the Google form, and then we'll insyaAllah doakan we will have the detect in Gambang insyaAllah with the ni. Okay, thank you.
Okay, thank you Brother Syamsul. Itulah mohon doa semua dah. Everybody pray so that this management is approved in the University Management Committee meeting next week.
Okay, maybe last two questions if there are any to our speakers, Dr. Edri or Dr. Ashraf.
This time nak tanya question lah. Okay, so moving forward through endemic ni, so tak tahulah, I dengar macam-macam rumours on our management where there will be release of burden ataupun release of ni from responsibility maknanya instead of we will have a few task force maybe there will be single task force and then without the operation room and all that. So I dengar macam rumours so I nak tanya komen Dr. Edri lah, what is the future direction because now we have operation room, we have the kuliah task force, we have macam-macam task force lah. So what is the future that you are predicting ataupun the management to instruct us to do? Okay, thank you.
Ya, ni this soalan Brother Samsul, dia a bit of yelah macam as you mentioned clearly kan, dia rumours. So bila dia rumours, dia unverified. Okay, possibly let's say the situation kita stable, okay, worldwide pun we can see the pandemic becomes severity becomes reduced. Okay, in our country also cases stable, case static. Once a while kita akan ada spike lah kan, ada outbreak, ada epidemic, tapi it will resolve. So that's the concept of endemic. Endemic boleh jadi epidemic. Maksudnya epidemic itu involves increase in number of cases, more than one area. However, if this one becomes stable, I foresee that possibly the need of bilik gerakan, the need of kuliah task force might not be so much already. Alright, meaning to say that the management will become something like pre-pandemic. Cuma the role for us, the ones that is handling currently handling the situation, we are more towards consultation unit, monitoring basis. Okay, example in Kuantan, kuliah task force is set up after the COVID. Before this, and some of the leaders are the deputy deans of student development, community engagement. So the role is more towards the DDSCDE. Not so much of the task force itself, but under the role of deputy deans for the students lah, especially. So there might be a change of role, tapi depends on the top management lah. We also requested the same principle kan. No need to have heavy burden for us. So that's hence the need for the change or the improvement in the management.
Okay, thank you.
Okay, maybe we open to one last question if there are any before we end our session. Okay, I believe there are no questions from our participants. So now we have to come to an end for our second segment. We have our last session after this. So thank you very much, Dr. Edri and Dr. Ashraf, for your time and your valuable inputs. Okay, inshallah, we will work this together. Okay, thank you very much. Next, moving on to our last session for today, okay, which is a session with Brother Typhoon Hisham bin Taib, Deputy Dean of Student Development and Community Engagement, and also the head of COVID-19 Task Force for CFS-IUM, to give his word on way forward to endemic transition phase for CFS-IUM. So the floor is yours. Please welcome Brother Typhoon Hisham.
Bismillahirrahmanirrahim. Alhamdulillah. Alhamdulillazi hadana lihadza wa ma kunna linahtadi laula an hadana Allah. Asyhadu an la ilaha illallah, asyhadu anna Muhammadan abduhu wa rasuluh. Assalamualaikum warahmatullahi wabarakatuh. First, greetings to our Honorable Dean, Tuan Haji Murshid Kasim, our Director, Madam Sharizat Saidul Hajj, Deputy Dean of Academic and Internationalization, Brother Jazha, to all head of department, deputy directors, senior officers, and all members, brothers, sisters. First and foremost, let us pray to Allah Subhanahu wa Taala for His blessing and rahmah, so that we'll be able to successfully conduct this sharing session on CFS COVID-19 mitigation process in CFS. I believe some of you might be already aware that the content for today is very different from what we have decided in our special CCM meeting, right? Whereas previously we planned to invite those who involved in the pandemic management process, but then we decided to invite Dr. Siti Mashita, Dr. Edri, and Dr. Ashraf. So thank you very much, these three very special person for giving us their thoughts and sharing their expertise to us. So thank you very much, Dr. Edri, Dr. Ashraf, and Dr. Siti Mashita. Yes, brothers and sisters, there is a difference in the content of today's sharing session. Number one, during our special CCM, at that time we were in the pandemic phase. So our decision at that time was more specifically on how to manage the returning student during pandemic. Yes, we anticipated this transition periods of pandemic, but during the special CCM, we don't have any idea when it will start it, So that's why we have to readjust because the phase is already different. Number two, brothers and sisters, with the new SOP announced by the government, especially specifically by the Prime Minister, where we see that the SOP is quite relaxed. So, for example, in the mosque, during prayer time, we are allowed to, get the staff to be close side by side together, alhamdulillah, with the best of Allah. And then traveling is allowed, the border already open, people are start to going abroad, traveling here and there. So that is why our SOP also must be relaxed. So again, we have to change. And then number three, hence, the decision during the special CCM have to be adjust and to be readjust. So previously we decided that we like to have all the staff involved in managing the student affairs. Yes, of course, but then during that time we have this idea that the staff must be on the ground to assist all our frontliners. But now it is different, brothers and sisters, whereby the role of the staff, whether it is academic or admin staff, are different. That's why now, as mentioned by Dr. Siti Mashita, that the frontliners is now already changed. Who are the frontliners? It is our client. It is the students. They are the one who now are the frontliners. So the role of the staff, whether it's academic or the admin staff, is to advise the students to be responsible and then to be alert about the surrounding situation and about their health status. So if we have this role to be enhanced among our team, then we'll have much during this COVID-19 mitigation process in CFS. So this is the way forward through this transition of pandemic. The change of role, the change of status, and then the change of mindset during this transition period towards endemic. So I think this is the thing that we have to be alert, to be aware of the adjustment and the readjustment that have to be made. I think with this little bit of time, for my last word, I'd like to thank all our expertise, Dr. Siti Mashita, Dr. Edri, and then Dr. Ashraf for your valuable experience for sharing with us for our preparation for this transition endemic to manage our returning students after Hari Raya nanti. It will be about 2,000 plus. And then a special thanks again to our Honorable Dean, Deputy Dean, Director, Deputy Director, HOD, Operation Room, head by Brother Samsul and his members, and to all liaison officers, thank you very much for assisting us and assisting our community. Last but not least, please be reminded that COVID-19 is still around us. So let us work together to remind ourselves and to remind others, to remind our colleagues, to remind our students, to take to the SOP and the self-responsibilities in managing now not just others but ourselves also. So again, we pray to Allah Subhanahu wa Taala so that we will move to endemic soon as possible, right? And everything will go back to normal. And inshallah, we have a good life in the future. Thank you very much, everyone. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh. Thank you.
Okay, thank you very much, Brother Taifun Hisham. Alhamdulillah. Now we are coming to the end of our sharing session. Once again, thank you to Dr. Siti Mashita, Dr. Adri, Dr. Ashraf, and Brother Taifun Hisham for lending us their time and feed us with inputs and information that we need to know. Okay. Also, thanks to all participants who joined us in this session, either on Zoom or YouTube, and show your interest, okay, to share the responsibilities. Okay, just to inform from organizer, inshallah, in the near future, there will be a town hall session involving all staff, including academic and administrative, on recent SOPs and guidelines for CFS IUM. Okay, on behalf of the organizer, Office of the Director, COVID-19 Task Force, and also COVID-19 Operation Room, we hope that all participants has a clear picture on the topic discussed, and may Allah guide us and bless us with His protection. So we end our session with Tasbih, Kafarah, and Surah Al-As. Okay, Assalamualaikum, and thank you very much, everyone.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Thank you, Tuan Haji Mushe. Thank you, Brother Typhoon and everyone.
Thank you, everyone.